Hi, I'm Prof. Mike Levine. I work at UCT and the Red Cross Children's Hospital in the Allergy Division. Asthma pumps or metered dose inhalers must be used with the best possible technique to get the medication to the deep part of your lungs. Although asthma pumps can be used on their own, adding a spacer to the front of the pump makes it a much more effective way of getting medication to the lungs. All children and most adults with problematic asthma should be using their pump with a spacer. There are 3 different ways of using an asthma pump, depending on the person's age and their capabilities.
The way a baby uses pump is with a spacer and a mask. The mask is needed because the baby can't close their mouth over the spacer. This makes it easier for the baby, but not for the mom. She has to make sure that the baby is calm, that the mask is fitted tightly over the face so that the air can't slip in and outside, and that it stays on long enough for the baby to take at least 6 breaths.
The mask doesn't actually make the pump more effective. It's just that you have to use it if the baby can't close their mouth over the mouthpiece of the spacer. As soon as a child is able to form a seal around the spacer with their mouth, you can lose the mask, but remember to keep the spacer. The spacer is the really, really important part. Using the pump with a spacer in the mouth can be done by breathing everything in just one breath or by using 6 to 10 breaths. Younger children have to use multiple breaths and just breathe slowly and deeply in and out of the spacer about 6 to 10 times. With good training, however, most children and adults can learn how to use a spacer with a single breath technique. Watch as we teach this patient how to use their spacer properly. A really good technique to help people use their devices properly is to first demonstrate yourself how to use it, then help the patient do it while speaking them through all the different steps, and then finally allow them to do it while checking their technique. Remember to bring your pumps and your spacer with to every single visit so that you can demonstrate it again and again to fine-tune any problems.
Shake the pump, remove the cap, put it in the spacer. Put the spacer in your mouth with your lips tightly sealed and your tongue out of the way. Breathe out fully into the spacer. This removes all the stale air from your lungs and makes space for new air with medication. When your lungs are completely empty, breathe in slowly but deeply so the medication goes as deep as possible into your lungs. Hold your breath for 10 seconds, then breathe out through your nose.
Check out the patient advice pamphlets on how to use your inhaler device at www.allergyfoundation.co.za.
First, establish your predicted measurement. This is calculated by sex and height in children and by sex, age and height in adults.
Make sure that the mouthpiece is attached to the body of the meter and that the cursor is on 0. The patient should be standing straight. Inhale deeply, being sure to completely fill the lungs. Place the mouthpiece into the mouth between the teeth. This is important as the blow must come from the lungs and must not be influenced by the cheeks, as happens when the lips are pursed. And close the lips securely around it. Make sure the peak flow meter is parallel to the floor. Blow out as hard as possible using as much force as possible. Patients are encouraged not to bend forward while blowing. It is important that there is as little delay as possible between filling the lungs and blowing out. Repeat the test 3 times, returning the cursor to 0 between each blow. Use the best of the 3 blows as you're reading.
Your normal peak flow rate varies according to height in children and both age and height in adults. Once a patient's height has been measured and their predicted value has been determined by using a predicted peak flow chart, the patient can then blow into the peak flow meter.
A peak flow meter is a small device that measures how fast you can breathe out. Using a peak flow meter is an easy way to measure lung function and to help your doctor to diagnose asthma and to know whether asthma is well controlled or not.
3 separate tests are performed, and presuming that there is reproducibility between them, the best of the 3 blows is recorded as your actual measurement. If this result is less than what is predicted for that patient, it's an indication that obstruction is present. If the patient has reached their predicted value or exceeded it, this is an indication that obstruction of the larger airways is not present. It's important to remember that the peak flow only reflects the lung function at that precise moment, and that other considerations, including the history, have to be considered when determining whether the diagnosis is asthma and whether it is controlled or not.
Nose sprays with an anti-inflammatory corticosteroid is the best treatment for all symptoms of allergic rhinitis. Using your nasal spray properly is important. With the right technique, you can be sure that the medicine is getting where it needs to, and you can reduce the chance of having side effects like nosebleeds.
Before you use your nasal spray, it's really important to blow out all the snot out of your nose or use a nasal washout. Otherwise, when you use your spray, the medicine just goes into that ball of snot and doesn't reach the place that it needs to be in order to work.
Keep your head upright. Gently push the bottle tip into one nostril. Aim for the back of the head and put the nozzle as far in as possible without it being uncomfortable. Aim the nozzle slightly outward, pointing towards the ear on the same side. Press on the other side of your nose with one finger to close off the other nostril. Release the spray and breathe in very slightly so that the spray doesn't drip out immediately. Do not breathe in hard or sniff the medication up so that you can taste it in your throat. Repeat in the other nostril. Hold the 2 nostrils together so spray doesn't drip out, and lean forward for 30 seconds. This allows time for the spray to spread through the nose but not to drip down the back of your throat.
Remember that steroid nasal sprays need to be used every day, whether you feel unwell or not, because they fix the underlying swelling and inflammation. They are not just used occasionally for symptom relief. You won't really even feel the effects immediately because they take a few days before the maximum effect is felt. Check out the patient advice pamphlet on nasal sprays and washouts at www.allergyfoundation.co.za.
Nasal washouts or irrigation helps you to clear snot from your nose, to improve your airflow in and out, and to allow your steroid nose spray to work properly. Nasal washouts can be done with special bottles that you can get at most pharmacies. These look a bit like a soft baby's bottle with a nozzle attached that fits into your nose. To use a nasal washout, get ready by preparing a solution using boiled water that has cooled down to about body temperature, and either mix it with the sachets provided or use a homemade solution made by yourself.
Put your head forward over a sink. Stick the tip of the bottle firmly into one nostril to make a tight seal. Breathe through your mouth only or pant like a dog so the water doesn't enter your mouth. Squeeze gently so water comes out slowly from the other nostril. Repeat this in both nostrils until the water comes out clear. Gently blow your nose once done. Use your steroid nose spray after irrigation.
solution for nasal irrigation is available in little sachets from pharmacies that are then mixed with boiled, cooled water. Alternatively, a homemade solution can be made from 1 cup boiled, cooled down water, half a teaspoon salt, and a quarter teaspoon baking soda, bicarbonate, not baking powder. If it tastes too salty for you, just put in a little less salt so that it's a bit like tears. Check out the patient advice pamphlet on nasal sprays and washouts at www.allergyfoundation.co.za.
Using a dry powder inhaler is extremely simple. It requires the person to breathe in hard, so is only suitable for older children and adults. To use the inhaler, you need to load it. The tape inhaler and the twist inhaler are loaded by twisting. The accuhaler, aerolizer, and ellipter are loaded by clicking the levers.
Breathe out without the inhaler in the mouth so the dry powder inside the device does not get wet. Then, when your lungs are completely empty, put it in your mouth with the lips tightly sealed and your tongue out of the way. Take a strong, deep breath in until your lungs are completely full, and then hold your breath for 10 seconds. Easy.
The main cause of eczema is leaky skin that then becomes dry. Moisturizing ointments make an oily layer on top of the skin, preventing the water from getting out and the skin from becoming dry. They are the most important treatment for eczema and should be used as often as possible throughout the day. The moisture does not really penetrate the skin, rather it's the layer on top of the skin that counts. So when the emollient can't be seen or felt properly, or if you get itchy, it's time to put on some more.
When you put on an emollient, be gentle. Take it out of the tub with a spoon or use a pump action bottle to avoid you having to dip your fingers into the pot, which might introduce germs. Spread the emollient down the body from head to the toes and go in the same direction as the hair follicles to prevent any irritation. Never rub it in or smear it back and forth. Make as thick a layer as is pleasant for you or your child.
To let it really work well, we sometimes recommend wet wraps. Wet wraps keep the emollient against the skin, stop it being rubbed off, help it penetrate better, cool and soothe the skin, and prevent you from scratching while they are on. They are usually used overnight, but can also go on during the day.
The layer close to the skin should be made from a material that is stretchy, smooth, and has no contact allergens, seams, or labels on it. The Allergy Foundation of South Africa has just launched a range of special clothing for this underlayer. The layer is dipped in warm water and then wrung out so it is still wet but not soaking. The whole body can be covered, or just specific areas like hands, body, and even the face. As soon as the child has the wet layer on, a second dry layer is put on top.
Wet wraps can also be used with a steroid ointment or cream. We recommend the steroid is put directly on the skin, not mixed with the emollient. This allows you to use different steroids on different parts of the body and only use them where you need them, but with the same thick layer of emollient on top. The amount of steroid ointment used should be enough to work, but not so much that it is wasted and used up too quickly. A fingertip unit is used to measure out the steroid amount. This is the amount that is squeezed from the tip of your finger to the first crease. You can work out how many of these fingertips units are needed depending on the size of the person using this chart.
Check out the patient advice pamphlet on eczema, eczema action plans and wet wraps at www.allergyfoundation.co.za. When you are having an asthma attack, it's important to be able to get as much medication as possible into your lungs. Two ways of doing this are either to use a normal asthma pump or a nebulizer. Many people believe using a nebulizer is better than an asthma pump. However, the real difference between the two is the very high dose of medication in a nebulizer. To give enough medication with an asthma pump, we use what we call multi-dosing, using 6 to 10 puffs of the pump over the course of a few minutes. Each puff must be inhaled separately and as effectively as possible, using a spacer and with a long, slow breath. Then you wait about 30 seconds to a minute while you shake the inhaler again and get ready for the next one. Repeat this 6 to 10 times and the effect will be at least as good as a nebulizer.
When you use a nebulizer in hospital, it is powered with oxygen, not with air. The life-saving oxygen is why we use the nebulizer in hospital. A nebulizer used at home doesn't have the same effect and can easily be replaced with multi-dosing.
When you use a nebulizer, breathe slowly but deeply. Short, shallow breaths will not allow the medication to get into your lungs.
Urticaria are raised swellings that occur on any part of the body. They are itchy but not painful. They move around from place to place and don't last for longer than 3 days. When they heal, they leave no trace or change in color of the skin. Viral infections can cause a single episode of urticaria. Urticaria is a common feature of anaphylaxis, but in this case, there will also be symptoms elsewhere, such as change in the voice or cry, difficulty breathing, or signs of whole body reaction, like feeling faint, falling down, or going blue. If any of these things I've mentioned have been present, go see your doctor immediately, because that's not normal urticaria. Chronic urticaria lasts for more than 6 weeks. It can be improved by avoiding some foods that increase your histamine pool. This is not because those foods cause an allergy, but because they can bring out the signs of chronic urticaria more easily. For a list of those foods, check out the patient advice pamphlet on urticaria at www.allergyfoundation.co.za. Treating chronic urticaria requires you to use an antihistamine every day to prevent the bumps from coming up. The newer, non-sedating antihistamines can be safely used like this and in doses up to 4 times that usually used for a single episode of urticaria or for hay fever. The older, cheaper, sedating antihistamines shouldn't be used for long periods of time or in high doses. If you are not having itchy hives, but have episodes of bigger, deeper swelling that is not itchy but may be painful, immediately see a doctor to check whether you have angioedema. Angioedema is caused either by some medications or by a hereditary condition and can be very dangerous. Find an allergy-trained person to look into this for you at the Finding a Medical Professional listings on www.allergyfoundation.co.za.
So an EpiPen is the solution to the problem of somebody having anaphylaxis and needing to give themselves a dose of a medication that is going to help them. This is a emergency injector device that should be kept with you at all times, like in your school bag, for example. And the first thing to realize is that you need to know when to use this device. So if you've been exposed to something that you might have an allergic reaction to, you could start having a reaction that could be relatively mild, involving the skin, or it could immediately start with involvement of your airways, difficulty breathing, falling down, hopefully not collapsing. And in the early stages of that reaction, that's when you use this device. And if there's any confusion that you think you might need the device, but you're not sure whether you should be using it, that's the time when you actually have to use the device before it gets too late. To actually use it, what you do is you take it out of its protective case. You just hold it in your fist without a finger over the top or the bottom. You pull off the blue protective cap. You take it in your hand and you swing it against a line that you draw on your upper outer thigh in the large part of the muscle. You swing the injector in, you hold it in place for 3 seconds, and in doing so, what it does is injects a dose of adrenaline into your body and hopefully saves your life.